Iliotibial band syndrome is a common condition in runners leading to pain on the outside part of the knee. In this video, we'll talk about the mechanism of iliotibial band syndrome, some rehab exercises to help with iliotibial band syndrome, and then also some running biomechanics. So the iliotibial band, or the IT band for short, is a band of thick connective tissue on the outside part of the thigh that connects the glutes down to the lower leg. And when it becomes irritated, it leads to pain on the outside part of the leg, and typically this is through overload, so it can be either increasing your mileage too quickly or incorporating heel runs are the two most common scenarios. Previously, it was thought that iliotibial band syndrome was a friction issue. What would occur is that the iliotibial band would be rubbing back and forth on the outside part of the leg, and that's what led to the pain. However, the iliotibial band is actually attached firmly onto the femur bone here, so it actually can't move, causing that friction. Instead, it appears to be a compression issue of that iliotibial band against the outside part of the knee. And this is due to internal rotation and adduction of the leg, which leads to compression of that iliotibial band against that outside part of the knee. And so over the course of a run, that repeated compression leads to the irritation. And because this is a compression issue and not a friction issue, it's going to change the way that we treat iliotibial band syndrome, because doing things like stretching and foam rolling are actually going to increase those compressive loads. So when looking at rehab exercises, we can think of the iliotibial band as a long tendon from the glutes and the tensor fasciae lata down the side of the leg. So instead of doing things like stretching and foam rolling, which are going to add more compressive loads and more irritation to the iliotibial band, we actually want to build up capacity to load. So we actually want to do strengthening exercises for the glutes and the tensor fasciae lata at the hip. Depending on the tolerance to loading, there are a couple different exercises that could be helpful for iliotibial band syndrome, with the easiest being glute bridges and clamshells. For the glute bridge, start by lying on your back with your knees bent and your feet flat on the floor. Place an exercise band around the knees. Push out against the band to help activate the glutes, and then lift the hips up off the ground as high as you can go. The goal is to have full extension at the hip so that our knee, hip, and shoulder are all in good alignment, and then slowly back down. When we perform these, we want to perform them slowly, ideally over 6 to 8 seconds. That way we make sure we're loading the glutes as well as the IT band sufficiently when we perform all the exercises. For the clamshell, start by lying on your side with the knees bent and a slight flex in the hip. Again, have an exercise band around the knees. And then from this position, keep the heels together and slowly rotate the knee up towards the ceiling and then slowly back down to that original starting position. There's a tendency when we perform these that the hips start to rock back, which takes some of the load off of the hip. So we want to keep the hips perpendicular to the ground and then just isolate that hip with that rotation. With both the glute bridge and the clamshell, we're not meant to stay with this exercise forever. We're just trying to start to load that hip and the IT band until we can progress to the next exercise. For the next progression, the emphasis is loading in a standing position, so we could do lateral steps and squats. For the lateral walks, the exercise band can be placed at the knees, around the ankles, or around the feet, with the feet being the hardest variation. To perform, we want to take a step out to the side, and then with the back leg, we want to bring it back to that starting position. And so what we want to do is avoid just sliding that foot on the ground, so that way we're working both sides. So to go the opposite direction, take a step, and then step with the back leg, out, back, out, and then back. With the squat, we can modify to emphasize more of the glutes versus the quads by sitting back further into the squat. This movement is similar to sitting in a chair. Again, we can use an exercise band around the knees to get a little bit more glute activation, and then slowly push our hips back, and then back up to that starting position. Additionally, we can also use a weight like a kettlebell to just increase the challenge of the movement. And then the final exercise is the emphasis is to load in a single leg stance. A step up to march loads the hip and the IT band in a similar motion as running. To perform, just like the name suggests, we're going to step up onto a step and then use that front leg to lift ourselves up into a march position and then slowly back down into that starting position. And so we really want to focus on using that front leg and not using the back foot to push ourselves up into that position, but to use that front leg to lift up slowly into that march position and then slowly back down. The final exercise is a single leg deadlift. To start, have a slight bend in the knee and then slowly lower the torso down towards the ground, rotating only at the hip, trying to keep the spine still, and then back up to that original starting position. Having the weight on the opposite side of the stance leg increases the challenge on the hip. So again, slight bend in the knee, and then slowly lower down, and then back up to that starting position. When we perform these, it's also important that we keep the pelvis level and we try to minimize rotation through the pelvis. When returning to running, there are a couple different technique factors that you need to consider as well. With all the previous rehab exercises, the emphasis was on strengthening the glutes since internal rotation of the hip and adduction of the hip increases the compressive loads of the IT band. However, the problem is that strengthening the glutes doesn't appear to change the amount of hip internal rotation and adduction during running. So while strengthening the glutes for iliotibial band syndrome helps with the pain, it's not actually going to change your running biomechanics that might have led to the pain. Instead, increasing your step rate during running by 5 to 10% will help to decrease the amount of internal rotation and adduction of the hip, which will help to reduce the loads on that IT band. This is also potentially why newer runners or runners that are going to fatigue will experience iliotibial band syndrome, because as their step rate reduces, it's going to increase those compressive loads. In addition to increasing your step rate, for some individuals, increasing their step width can also be helpful. If the foot is making contact too close to midline, then the hips are going to be adducted, leading to more compression of that iliotibial band. So you might have to look in the mirror when you're running on a treadmill, for example, to see how close your feet are to making contact with midline. Hopefully this video on iliotibial band syndrome was helpful. If you're a runner, you probably want to watch this video next, and if you want to stay current on the treatment of other running injuries, subscribe to the channel over here.